We really are already experiencing quite a significant respiratory season, and we anticipate more illness as the winter goes on. Really, I encourage families to do good hand washing, make sure their child is getting good nutrition, adequate rest. Those are some of your best defenses, along with immunization if it's appropriate. If your child is sick, even with relatively minor symptoms, it's wise to try to stay home or avoid group settings. Good hand washing is helpful in preventing the spread of infections like this, but also just the basics, making sure your child is getting adequate rest, a well balanced diet, daily exercise. These are all things that can help your child be protected from illness. Some of these respiratory illnesses are vaccine preventable, or vaccine can help to lessen the severity of the illness. And the two that come to mind on that one are COVID and influenza. Vaccines for both of those illnesses are available for children aged 6 months and up, and they're highly encouraged by pediatricians that kids get those. The vaccines are safe. They are effective, again, at either preventing illness or preventing some of those serious complications. This year we had a particularly early and hard-hitting RSV season. So whereas we might typically see it in January or February, we had a lot of cases in October and November this year. Lots of patients in our urgent care, our primary care clinics, and in the children's hospital. Well, RSV really is like a cold with respiratory symptoms. So you might see fever, runny nose, cough, irritability, just those typical things that you would see in your child with a cold. I think with any type of respiratory illness, if your child has a fever that's lasting longer than 3 days, if they're having trouble drinking or keeping down fluids, especially if they're at the point that they're having decreased urine output, or if your child is having really labored breathing, and that would mean fast breathing or breathing that looks like hard work, where they're using their chest muscles to get air in and out. Those would all be red flags that you'd need to seek care from a provider. We know it's hard when your child is sick, and it can be really confusing to understand what type of illness they have and what you should do about it. I always want parents to reach out to their primary care provider if they have questions about their child. And the Ask a Nurse hotline is a great way to get advice about whether or not your child needs to be seen by a provider. If your child is sick with mild symptoms, they don't need to be seen by a provider. Like it's okay to be at home, to offer them rest, over the counter pain relievers or fever reducers if that's necessary. Make sure you're helping them with hydration and just offering them some TLC. That's very appropriate for mild symptoms. But again, if you feel concerned about your child's well-being, don't be afraid to reach out and contact us. We're happy to see them anytime.
This winter has already proven to be more concerning than the last two. What we've seen so far is RSV in children. But what we know is in years with RSV spreading well, flu tends to spread well. We presume, and I think we'll be correct in this presumption, that COVID is going to spread well in the same time. Now, the COVID virus that we see this year is different than the one we saw 2 years ago. The fatality rate isn't the same, but it's still 350 people or so dead every day in the United States from COVID. And so because of that, especially if you carry risk factors, I absolutely recommend the COVID vaccine. And you do need to understand that there's a new COVID booster out now that covers not only the original strain from 2 years ago, but also covers the strain that's most prevalent as we speak. The flu vaccine, especially in pregnancy, is one of those times where you don't want to put your body through additional stress. Being pregnant is stressful enough. And so making sure you're immunized to prevent any illness that you could possibly prevent while you're pregnant is a very, very important tool to make sure that that baby has the least eventful, healthiest pregnancy they possibly can. We do recommend the flu vaccine in all of our older patients, especially if you happen to live in a place like a long-term care facility where you have lots of older people around. We've seen in many years past that influenza can travel around that group of people very quickly. And so doing everything that you can to protect yourself from getting the disease and from landing in the hospital is absolutely key. First and foremost, you have to understand what the best way to protect yourself is. For some people, they're young and healthy and don't have any medical problems. And so getting their flu shot and getting their vaccine is what they're going to do, and they're going to be just fine. For other people, they are older, they are sicker, they come in with other medical conditions, and they may decide still that wearing a mask is better for them at the holidays. Then making sure they're up to date on those vaccines 2 to 3 weeks before they go is very important to them. Making sure they wash their hands recurrently, which by the way is a great tip for everybody. Making sure everybody covers their coughs and sneezes, does the important things we all know just as far as regular hygiene when you're at a get-together with your family. Those things still all hold. But what I would recommend for those folks who have other reasons to be concerned is you can still make those choices to say, I'm not going to the family gathering, or I'm going to go to the family gathering and do these things slightly differently than everybody else. And those choices still should be honored, and those choices should be made on an individual basis to make sure you're comfortable with your own risk.